as a clinician and an emergency physician who's been working on the front lines in the COVID-19 pandemic for almost 2 years, I have to say that myself and many of my colleagues are very fatigued. Professionally, I'm burnout in the sense that I've had to have a very high caliber level of medicine that has been new and not as familiar because we're dealing with a disease that we're not really sure how it's going to function. And so that's been challenging from a clinical standpoint. And then patients have been very frustrated and sometimes take those frustrations out on us in the department, even physically, especially in the emergency department. There's a lot of literature that talks about how, nurses and techs and doctors actually get physically kind of involved with patients, whether it's psych patients or people who are altered. And so it's not just that, I'm using my mind and, all of my intellectual skills to take care of people, but I actually physically have to get involved and do procedures that might, and result in me feeling really worn out or potentially accidentally being hit by a patient. So that kind of high level of stress and being in that environment for prolonged periods of time really wears on you, not just your mind, but certainly your emotions and your body as well. So there's been quite a few studies that have kind of looked at burnout in the last couple of years because it's been well known that there has been basically huge waves of people who are leaving healthcare altogether. A number of studies have documented that maybe 1 in 5 healthcare workers have left the profession altogether. And I know a recent study that focused on emergency physicians showed that we're approaching a 40% burnout rate, with people saying that they're either going to retire early before the age of 55 or have a significant career shift within the next 2 years. And so I think these are all signs that show that people cannot maintain the status quo. So I think there's a couple of things that we need to do to better support physicians. First and foremost, the basics need to be covered. So safety at work, having appropriate staff and appropriate resources so that I can take care of patients is important. For several months now, we've had a critical nursing shortage. So that means when I go to work, there could be up to 40 people in the waiting room. There's not enough medical staff to take care of who we really need to be able to see. And that puts a lot of pressure on me as a physician to do a lot of things that, first of all, are not necessarily in our job description. I might be wheeling patients places, taking them to CT scans, doing the jobs of other healthcare providers because we just don't have the bodies on deck that we need to take care of doctors. And that definitely wears people out over, a period of time. In addition, people have been working more than they've expected. And so I think there needs to, in general, be a shift in what is expected of physicians as far as their work week and hours. I think that people will be better at maintaining wellness and therefore their ability to be outstanding physicians if they have reasonable hours that they're working so that they don't burn out. And then finally, I think that, we need to really have programming and resources that's directed at wellness. And wellness is more than just, listening to a podcast or having, an outing with your coworkers. It's actually really getting into the nitty-gritty of what are the, social, emotional, physical, and intellectual needs that clinicians have that we can better serve so that they have balance in their life and they're able to have more long-standing careers where they're happy and productive and able to do, their best and take care of patients to the best of their abilities because they themselves are also living their best life. So I get questions a lot about, how do I maintain myself as a practicing ER doc and a mom of 2 young girls and a CEO and founder of a medical device startup. And number one, I don't sleep enough and I need to work on that. But I really do try to emphasize that there needs to be better work-life balance. So I take really seriously some of my wellness tools. And one of them is I respect a day of rest. So Monday is actually my day of rest. I try not to work on Monday, answer emails on Monday. I actually, give myself the freedom to, go to the zoo with my kids or going to the Wizards game, which we do pretty frequently during basketball season with my husband. And those little things, I think are what are able to fill me up enough so that I can persevere and move through the tougher times that I'm working clinically or, really striving to grow my company and do the many things that, I juggle as a working professional mom.